We all know that healthcare costs are rising, but a report out today shows us by just how much. According to the Commonwealth Fund, health insurance premiums rose 3 times faster than the median household income over the past 6 years. For more on this troubling trend, we're joined now by Bloomberg's Shannon Pettypiece. And this would be why healthcare reform advocates argue reform is needed.
Right, absolutely. I mean, we've been talking about the rising cost of healthcare. Everybody's been feeling it. But yeah, this report out recently by the Commonwealth Fund shows premiums increasing 3 times as fast as household incomes, deductibles 5 times as much. And now the average person under 65, about 20% of their income goes to pay premiums. So healthcare costs are really outstripping the average income.
And what's driving that?
Yeah, well, part of it is because incomes really aren't increasing. And actually, we have a chart here. You can see the incomes are decreasing. So that's part of the factor here. But another element is that people are more sick. They're not as healthy as they used to be. You have an aging population. You have chronic diseases like diabetes, and those cost more. The more sick people insurers have to cover, the more they have to increase premiums for everyone. So that's what the insurers say driving this. Now, there's also people who say it's part of these profits, these record profits that insurers have been making that's been driving that as well. But you kind of have a combination of factors here that are really putting more of a pressure on households when it comes to healthcare costs than they were in the past.
Is this trend then going to continue unless wages start rising very, very quickly?
Right. Yeah. Well, if insurers have their way, it will continue. We've had a few insurers who have already tried to increase rates. We had WellPoint try to increase them 28% in New York. They tried similar increases in California and Connecticut. So insurers still feel like they need to be increasing rates and premiums and deductibles to be able to cover their costs for all these factors that I mentioned before. But the health reform bill is trying to put a cap on this. Now, one thing that they've done is they've given states the power to say that you can deny a rate increase, or you can make an insured justify or explain why there's a big rate increase. And new rules out earlier this month said that a 10% rate increase is what you should expect. Anything over than that, the insurer is going to have to come back and justify why there is such a big increase. So more like we may see about 10 or 14 or 15% increases coming.
So 10% is not a problem, but beyond that, you'll have to justify?
That's what federal regulators said in these guidelines that they put out. Now, these are guidelines that states get to choose to follow, and it's going to kind of vary state by state. And some states with, a Democratic governor may be more strict on rate increases, where Republican governors have said, well, we think the market should determine this. Let's leave this up to the market to determine. So we're going to see a bit of variation there, but we will continue to see. We're not going to, as incomes are probably increasing 1 to 2%, if increasing at all, health insurance is going to continue increasing. It probably around that 10% range. 14% increase we saw in California was recently approved by the California government.
Right.
Like I said, in New York, WellPoint wants to increase the plan for small businesses about 28%. The state said, we don't know about that. We're going to have to take a look at why that increase is there.
Let's bring this back to the healthcare reform package. How is that going to affect this?
Right. Well, and there's also things. This was part of the healthcare reform package saying that states could regulate that, but also trying to lower the overall cost. And that's kind of the problem here, lowering the overall cost of healthcare. The biggest percentage of healthcare spending goes to physician visits and hospitals. Trying to make that more efficient. Electronic medical records was one thing healthcare reform wanted to see. More preventative measures, trying to prevent chronic diseases like diabetes. Diabetes is a huge cost, and actually a report out that we were talking about just the other week showed that about 50% of people will be pre-diabetic or diabetic by 2020. So preventative measures, that's going to be a big thing to try and lower these costs as we go forward.
Preventative measures as one way to kind of stem the increase in healthcare costs. Thank you so much, Shannon Pettypiece, covering the healthcare industry for us.